most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Well, which means we're not the most humble therapists on the internet.
Well, we'll work on it.
Okay, today we're going to talk about five sleep positions you should avoid.
Oh, sleeping.
These positions can cause neck pain, shoulder pain, or hip pain.
That
so
covers
we're
a
gonna
lot
cover
of
all,
it.
yeah. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Go to bobandbrad.com. Go to the giveaway section. We're always giving something away. Brad's going to demonstrate or model what we're giving away.
The loops, the large loop sets.
Yeah. You can do a lot of exercise with them, and they also assist with pull-ups.
Absolutely.
You can go to Facebook. It'll be pinned to the top of the page. The contest. Go to Twitter, Instagram, TikTok. What else do we have?
We got
Podcast.
Zen.
We got Zen.
Oh, that's right. The podcasts are up and running.
We got now we have also Bob and Brad clips.
Oh,
if you
that's
want only
right.
60 seconds. Of
Yes.
Okay, let's get started, Brad. All right, the first position that's not good for you is to sleep on your stomach. And the reason that is, I should probably do it.
Yeah, go ahead. Sure.
Why don't you hold on to these?
Oh, I get the pillow duty. That's right.
So, where's my mic? On this side, so I got to lay on
your
this
head.
side. Lie on this side. So if I'm on my stomach, I'm turning my head all the way around to the end. And the thing is, joints don't like that. They don't like to be at end range. And I've told this story many times, Brad. You're probably sick of it. But when I was at a class one time, they asked all the people, it turned out there was a complete...
What, kindergarten class?
No. This was a physical therapy class.
Continuing ed.
Yes, continuing ed. They asked the people how many people slept on their stomach.
Mm-hmm.
And they asked after that, how many of them get headaches?
Mm-hmm.
100% of them did.
Yeah.
So you can get those headaches that start in the back of your neck,
Mm-hmm.
at the base of your head, and they can come around and go into your eye.
Yep.
It could be caused by that all-night rotation.
Right.
So, all right, next one. Just sleeping on your back with too many pillows.
Oh.
So we're going to demonstrate that. Why don't you put 3 pillows there, Brad?
Yeah. Right here?
Yeah, that's fine.
There we go. Stack them up.
Yeah, I mean, and now it could be that you're just trying to watch TV or something, but look, I'm in this flex position.
Yeah, get over. Let's go this so they can actually see. There.
Yeah.
Look at that. The neck is going like this. His body's like this. We've got a flexed neck.
Yeah.
It's almost to end range, you know?
Yeah, it's just not good to be the neck flexed like that. And then the problem with this too is that you begin to feel like this is normal. When you get up, you go, well, this feels normal to have my head forward.
You got the beginning of a hunchback.
Right, right.
Yeah, the what else we call the hunchback? The
yeah,
kyphosis. There you go.
Well,
the
that could be a
technical term.
kyphosis.
Yep.
The other thing you can do instead of this is actually get a bed wedge.
Right.
Now, what we've discovered something here today. Where is it, Brad?
Right here, Bob. Right here.
Yeah.
This is actually a leg wedge, but
yes.
it works as a.
Let me show first.
Oh,
the way a lot of people use it, and this might be good if you have hip problems or back problems. This is very comfortable.
Oh yeah, yeah.
Brad loves this thing.
I do, and I've had many patients that appreciated it.
But now the bed wedge actually is shaped like a triangle, so it's like this, and this part is filled in, obviously. But this would work for both.
I think it works great.
I'll take 1 pillow, Brad.
So if you are a TV watcher, this would be a good thing. Or you have breathing problems, you need to get your COPD.
Right.
Which you want, 1 or 2?
Just 1.
Yep, right there.
So, yeah, once you get it, like if it's up against a bed rail, it stays in place.
I think it's great.
Now see my body's still straight. My neck is aligned with the rest of the spine. So my ears are close to being over my shoulders, which is what you want.
Exactly. So yeah, you can just, if you're earners, buy this and you have it for both. You got the leg wedge, you got the sleep wedge. Life is good.
All right. I need 2 pillows, Brad.
2.
And this is about sleeping on your side. You actually, and I'll need the throw pillow eventually here, Brad.
All right. Throw.
That's right over there. When you sleep on your side, you don't want to sleep right on the point of the shoulder especially if you're having shoulder pain.
Yeah.
But you can actually develop shoulder pain even if you keep sleeping right on that point.
And if you have a firm mattress, that's notably worse. I've noticed that.
Yeah, with a sleep ovation mattress, butt plug-in for them, it's a lot more comfortable.
Yep. Yep.
So, solution is, and I actually use this 100% of the time when I'm sleeping, is I have a throw pillow, and I put my arm through the canal into the canal here, and it takes pressure more here and here than right on the shoulder.
So this pillow is actually contacting your ribs.
Yes.
Yeah. Mhm.
I sleep this way on my left side almost continually every night.
Mhm.
So now the other thing you want to point out about the shoulder is you actually don't want to sleep with your upper shoulder, like this all night long.
Mhm.
You're stretching out the muscles that hold the shoulder blade in place.
Yeah, in the rotator cuff, those posterior muscles are they're being abused.
Well, if you do it all night after night,
Right. Yeah.
you know, if it's a habit. Now, if you do it once in a while, it's not a problem. But if you're going to do it night after night, yes, you should have maybe a pillow or even two. You can put one here and then one underneath your arm. I know this is a lot of pillows, but this especially if you're having shoulder pain
Right.
and it's in that shoulder blade,
Yeah.
it might be from that. You know, Brad and I actually just did this video not too long ago. We'll bring the skeleton around here, and what we showed you is that when your shoulder blades, if you want to know if they're in the right place, they're supposed to be 3 inches from the spine. So from here to the edge of the shoulder blade is supposed to be 3 inches. If you're more than that, you might have stretched that muscle out.
Mhm.
So you can actually have someone measure. You know, you feel the bumps along the spine,
Sure.
and then we don't have a tape measure, but it doesn't matter if you're 7 feet tall, if you're 3 feet tall. Oh, there we go.
Well, of course.
Yeah,
Bob. We can
and-
measure from there to this.
So how's he doing?
Sam, he's good. He's
Look at that.
3 1/8 there, and
They made it.
he's a little less on this side, but he's within tolerance.
Now I don't know if they can see it on me. Probably
Well,
not without tape.
Well, yeah, they're take your shirt off. We can draw it on your skin.
but actually-
I'll show Bob.
Yeah, show one side,
Right there is a center,
and the one side is 3 inches we measured, and the other side was only 2 inches.
yeah, and this side, and you're kind of squeezing together a little
Yeah.
bit. There we go. If you can see the distance between my hands there. Oh, there, look at that.
Yeah, and
Bob,
the reason is
why?
I actually lost a muscle in this the serratus anterior.
Maybe they can
It-
find it.
No, it's gone.
It's gone.
No, it deteriorated because I lost the nerve got affected to the muscle.
Yeah, you're
So-
younger then, right?
Yeah, I was a young guy then. So, all right, the last position we want you to avoid is again on your side. I'm gonna. Here, do you want to take the ruler?
Yeah,
Brad?
we'll measure something later.
And when you're lying on your side, and especially on women who have larger hips, could be some men too, larger
Yeah,
hips.
some men have larger hips.
And I actually had trouble with this. It caused pain. I used to sleep like this.
Yeah.
So
Well, you
know,
got those long legs. They
Yeah.
probably fell off and hit the floor.
Yeah, maybe they did, but you're stretching the hip all night long.
Yeah.
And I developed pain in my hip because of this. You can also develop piriformis syndrome,
Ooh.
you know, when it's stretched out.
Yep, that's that little
So-
muscle. You get leg pain as a result.
Yep. So, the answer to this is just to put a pillow between your
Yep.
legs, and I do that every night. So I'm a
take-
high maintenance.
Do you take pillows from your wife or what?
No,
She's got quite a few too.
Yeah, she does.
Pillows all over that.
Yeah.
If you got kids, you can just take their pillows.
Yeah,
They
pillows
don't,
galore.
They don't need them.
Yeah, it's a good time for Christmas to give out a pillow. Too,
Yeah,
so.
that's right.
All right. Remember, Brad and I can fix about anything.
Except for
A broken heart.
there you go. But we continue to work on that
We
endeavor.
yes.
Right, we're going to write chapter after chapter after chapter